Yeah, we've started recording.
All right, great. So hello everyone. It's great to have everyone who's participating be, a part of this really cool webinar that we wanted to put together. I apologize for the background noise. I couldn't help know where I am, but this is very, very exciting for me because after almost 2 years of starting the New Delhi Behavioral Network, um, I finally got to do what I had envisioned doing with it uh, since the beginning, which was to have turn it into a community-led platform where people could, who were interested in the field of behavioral science and behavioral economics could come together and learn and share knowledge and use this to keep growing in the field and learn more about what and how the field shapes our daily lives and even bigger problems and social concerns that we all face individually and as a community. So this year in January, the network was taken over by an extremely young and dynamic core team, and this is their first event. So I can't help but be a little proud. And today's topic is very, very relevant and it's interesting. And today's guest is somebody that I've been looking forward to listening to because I've heard so much about his work from friends and from the network, behavioral science community, and otherwise. So Nikhil is somebody that I met a few years ago and who's worked with more of an academic background to behavioral science, but he's always also been very interested in how it applies and how we can kind of use the learnings of it in our daily lives. So I'm going to pass over to Nikhil, who will introduce the theme and the speaker. And I hope you all enjoy today's session. Nikhil, over to you.
Thank you, Divyani. So welcome and thank you all for joining us for our first event of the year. The reason why we chose addressing COVID-19 vaccine hesitancy is because I think a year ago, all our lives were flipped because of COVID, the ensuing lockdown, and the paranoia associated with everything with COVID. But now we can see the light at the end of the tunnel because the world has produced a vaccine, I think, in the shortest span ever. In 10 months, we've produced a vaccine and we've gone through 3 phases of clinical trial. A lot of these vaccines have gone through 3 phases of the clinical trials. However, we still don't know how long our antibodies and everything will last, but this is a step in the right direction to recover and revive our economy. So anyway, let's all move on to the reason why you have joined us for today. I would like to introduce our speaker for the day, Saransh Sharma, who is the behavioral lead at Final Mile. Saransh has been working in research and design for behavior change at scale for a considerable amount of time. He is interested in complex social problems such as socioeconomic empowerment and public policy, and work on issues such as mother and child health, HIV prevention, financial inclusion, gender-based violence, sanitation, nutrition, and many more other topics. He has conducted primary research across various countries in the world, and I'm super excited to have him here address us for our first event. And also, again, thank you, Saransh, because I know it's early in the US. Thank you for taking out time to address us here. Over to you.
Absolutely. Thanks, Nikhil, and thanks, Divyani. Again, hello, everyone, and thanks for the NDBN team, firstly, to organize this event. I'm very happy to be talking about this topic. My team at Final Mile has been working on this, I think, all the way since September last year. And we've recently done some fieldwork as well, and we have some findings which I think we are very excited to share as well, and I think they are very pertinent and urgent in the current environment, of course. Thanks for the intro. I'll jump straight, I think, into the topic. Before that, quickly, a little bit about Final Mile and the work that I've been doing at Final Mile. So I've been with Final Mile since 2014 and been mostly working on development and social sector projects. I think some of them, Nikhil just listed, have worked considerably on public health Infectious diseases like HIV and COVID, as well as maternal and child health, which again is a major sort of global health outcome where Millennium Development Goals and all are also focusing. At Final Mile, what we try to do is take the learnings from the field of behavioral economics and apply it to very contextual problems. So we are not looking for one size fit all solutions. We do not do lab research, but we go and actually do research on the field to try to understand specific issues, and then integrate these behavioral insights with design and other methods like ethnography, like quant, to basically change behaviors at scale. And we have recently oriented the organizational focus now to focus only on health issues. And so COVID was a natural topic for us to work on, because last year has been a really the biggest behavior change exercise that we have seen at a global level. uh, People have had to change their behaviors, whether that be regarding hygiene, whether that be regarding distancing or usage of mask, staying at home. And now we have, as we are in another phase of the pandemic, as we see sort of the light at the end of the tunnel and the vaccine, which gives us optimism, we now are looking at another behavioral challenge, which is what we are discussing today, vaccine hesitancy. So, as I mentioned, we sort of started talking about this back in sort of September, October, where we realized that the vaccine is right around the corner, and it might release as soon as December, and that did happen. US did approve Pfizer and Moderna both for emergency use in December, and subsequently a number of countries joined again the vaccination campaign. India also joined the vaccination, started its vaccination campaign in January. And as we were speaking to a lot of stakeholders who were working on the vaccine, we realized that there were many hurdles to get to this point of having a vaccine that actually can be rolled out. There were, of course, a huge challenge in front of us, which was the pharmacological medical challenge, which was the research and development that was required to develop the vaccination. And our scientists all across the world really stood up to that challenge and delivered unprecedented results, right, in record amount of times. And it has really advanced our capabilities as a society to respond to pandemics by light years. Things that used to take years and decades have been done in a year. And that was a significant hurdle that we crossed. And then there were regulatory hurdles which were crossed. Many countries now have frameworks of how to actually roll out the vaccination, and countries are learning from other countries' experiences. Then we had the logistical framework. Again, there was Operation Lightspeed here that was planned in US. Similar operations are planned across the world. Uh, and logistics sort of, when we were talking to these stakeholders, logistics was the topic at the top of everyone's mind. That was the next big challenge that everyone saw. But what we realized is that people were not seeing the challenge that comes after that, which was vaccine hesitancy. That even if you have vaccines available in the market, people eligible to take the vaccine, a lot of people may still not volunteer to get the vaccine. That's how WHO sort of defines vaccine hesitancy as well. It's a delay in acceptance or refusal of vaccination despite the availability of vaccine services. And and so by October, November, we realized that this is a gap currently. A lot of the governments, a lot of the other organizations supporting the governments don't have a plan really. And so we thought that we would take sort of a self-initiated effort to use our knowledge. We've worked with infectious diseases before. We've worked with health systems before, and we've worked with mixed methods that can be scaled up, to sort of national level health outcomes. So we wanted to use these, to fill in those gaps. And so we started putting up an alliance of partners that we had worked with in the past, uh, who were like-minded, who had sort of complementary capabilities, uh, and who could basically work on this topic, who were willing to work on this topic. So we decided that we created this sort of coalition of partners, people we had worked with in the past, and decided that we were going to use, again, something that an approach that we have deployed to solve other complex problems in public health sector in the past. It's basically a mixed method approach where we leverage the strengths of qualitative research, where we try to understand behavioral drivers, which Final Mile does, and integrate that with quant research, which can basically take that deeper understanding that we develop and scale that to levels where you can, that can inform national policy, for example, and then take design uh, to basically help in solutioning and intervention development to solve these problems. And we have sort of used this exact or almost exact methodology in past on topics like maternal and child health in India and Kenya, uh, uh, driving voluntary male medical circumcision in Zambia and Zimbabwe, and uptake of PrEP, which is HIV prevention medicine in South Africa. And so these were the partners that we had worked with on these projects that we got together. And the first phase of this research was, of course, the qual research, which is developing a deep understanding of the topic of vaccine hesitancy. What really contributes to vaccine hesitancy? What are the different kind of hesitancies? How does sort of environmental factors impact that? How do psychological factors, behavioral drivers impact that? So that can be taken to sort of design solutions, as well as design national level surveys that can inform us about, the extent of hesitancy and so on. So we have, so this study we planned basically in multiple geographies. We have offices in US and India, and one coming up in South Africa. So those were naturally the geographies that we wanted to sort of understand this issue in. And so we deployed it in all these three countries. We have just completed the India leg of the call research, and some very interesting things coming out from there. Some misconceptions about vaccine hesitancy, which we hope this work will also be able to sort of address and add much more nuance, much more evidence-based sort of approach to our response to vaccine hesitancy. So I'll just share the document I'm going to take you through. All right, can you see my screen? Okay. So firstly, what is vaccine hesitancy? I just defined what WHO sort of defines vaccine hesitancy as, which is delay or refusal. But often when we spoke to people, often and the kind of understanding we saw within the system and stakeholders that were working on vaccine hesitancy, we saw that they were coming from a certain perception around what vaccine hesitancy is, which is not necessarily useful in this particular context, which is the anti-vaxxer movement that has been going on, particularly in the Western society. This movement is sort of ideologically opposed to vaccines, not a particular vaccine, but the very concept of vaccine. And their beliefs are that, vaccine especially child vaccine is what they oppose, that child vaccine, causes things like autism and major sort of developmental disorders and so on. It is not based on evidence. It is based on people's perceptions and uh, an ecosystem of misinformation that by vested interests has been sort of promoted in the West, and that affects a certain portion of the society. This is not a huge number. Anti-vax is definitely a fringe movement even in the West, and outside West, it's the Western societies. It's not really a very big movement. Even if it is, it's usually exported ideology, imported ideology. Uh, so we saw basically that a lot of people were still thinking in terms of this anti-vaxxer movement. So people thought of vaccine hesitant people as ideologically opposed to vaccine. These people would believe in conspiracy theories, would be very much in the midst of that misinformation ecosystem, uh, and that is what most people thought that they have to sort of address. And a lot of efforts that are going on globally right now to counter vaccine hesitancy, again, is working with this understanding and looking at fighting misinformation and so on. What we started seeing signs of early on, and which was validated later as we sort of delved deeper into this research and uh, spoke to people on the ground, is that there is not just this extreme faction of anti-vaxxers that are contributing to vaccine hesitancy, but that COVID vaccine context is unique, which is causing a new kind of hesitancy. It's a completely distinct phenomenon from this anti-vaxxer movement. It is the people who are sort of COVID vaccine hesitant. They are not necessarily ideologically opposed to vaccines, but rather they are basically embedded in a context where they have a lot of information about COVID and about COVID vaccine, and they don't necessarily fully understand this information. They don't necessarily know which kind of sources of information to trust, and hence either they are confused and nervous about whether they have the right information, or their decisions are being led by sort of wrong information, which are creating negative perceptions about vaccine. And what we see in this group is less of vaccine refusal and more of vaccine delay. So they may have the intent to take the vaccine if you ask them sort of at face value. It is only when you dig deeper that you will find out that even though they have confidence in vaccine, they want to sort of wait and watch what exactly this vaccine's effectiveness is, its safety is, how many people around them are taking it, which brand are they taking, and so on. And we call this the movable middle. So these people in the middle who are fence sitters about vaccine are movable, right? We can influence them because their perceptions are based on information and not on ideology. The anti-vaxxers that we are seeing are ideologically inclined towards vaccine hesitancy. It's very difficult to move them, but also for achieving herd immunity, we don't necessarily need to move them because it is a fringe movement. It's not a huge population in any country. So if you sort of decide to vaccinate the anti-vaxxers last, you can still reach herd immunity in most countries, right? So you can basically end the pandemic without having to move the anti-vaxxers, which are the extremists. But what can really delay your herd immunity is if the movable middle is not moved towards vaccine, and if they continue to be a little wary of the vaccine and continue to delay their vaccination, then the herd immunity could be delayed. So this is a very important sort of segment of population to study. And so now jumping into sort of, so this was what it is not right now, what vaccine hesitancy is not, and particularly COVID vaccine hesitancy. Because again, when we say vaccine hesitancy, most people think of anti-vaxxers. COVID vaccine hesitancy is very unique. People might not be uh, opposed to vaccines at all. They might have their children vaccinated, for example, but about COVID, they might still have some doubts. And what this hesitancy is coming from is basically these three factors that you can see on the screen. One is the unique context of COVID. Uh, the other is people's mental models about vaccination. What is a vaccine? What do people understand when you say a COVID vaccine? And thirdly, how people are sort of evaluating the risks and benefits of vaccination or not taking the COVID vaccination. So, what are these trade-offs that people are making, right? What risks do they perceive? What rewards do they perceive? And we see that all these sort of come together to create a hesitancy spectrum, uh, which goes all the way from being confident about vaccine to being confident yet slightly confused about how effective or how safe this vaccine is, and all the way to skepticism about vaccine. Again, I'm talking about the India study right now that we have completed. Here we don't see anti-vaxxers so much. Even in our study, we did not see people who we could classify as anti-vaxxers. So at the other extreme, we see of the spectrum, we see skepticism about vaccine. We don't see ideological opposition. So let's jump straight into it. What are these three factors, right? Firstly, the COVID context. Uh, why is COVID vaccine and how people are perceiving COVID vaccine, why is that so different from how people perceive vaccination to children, for example? And that's, of course, dependent on how people are interacting with this particular environment and the information in it. And that sort of interaction also is not a single sort of monolithic thing, but something that has evolved during 2020 and now in 21. There are many stages. um, so people are sort of constantly adapting to the information around them. They are assimilating information, and adapting to it, and this information keeps changing with some of these major events. And in India, we saw that some of these major events which created this sort of change in perception about what is the COVID risk, how do individuals need to respond to COVID. These were at 2 points. First was, of course, I mean, 3 points. First was lockdown, which created this perception of extremely high risk. It was emotionally very salient. Everyone was impacted by it emotionally. Everyone was also impacted by it sort of economically, socially, and most people complied at that point. So lockdown, you see self-preservation behavior driven by emotions like fear, and people were really locked into information, trying to understand what's happening around them. When this changed is when unlocking began, right? And governments across the world reacted to sort of dip in COVID numbers, uh, and also the building up lockdown fatigue. The governments decided that they are going to relieve some of these restrictions during lockdown. And in India, it was done as a deliberate unlocking campaign. And the message that went across was that the risk is still there. So the compliance to distancing and mask wearing and hand hygiene still has to happen. But uh, economic activities can return to normal. So that was sort of the mental model of people, that it is manageable now. If I take the right steps, I can go around with my economic activities, my social activities, and that continued to sort of improve through multiple stages of unlocking. And this again changed again with another milestone, which was the vaccine discovery. vaccine discovery gave a new sense of sort of optimism to the entire response to COVID. And suddenly there was, again, a light at the end of the tunnel, which led to an even further decrease in risk perception and an impatience to sort of quickly get to normalcy. Uh, but at the same time, this also led to a new influx of information. There was already a lot of information about COVID and how to protect yourself around COVID. And after a year of being in the pandemic, people were starting to wrap their heads around it. And now suddenly you have another factor which you have to wrap your head around, which was vaccination. And people were struggling to find what are the trusted sources. People continue to struggle with that. A lot of the information about vaccine is very technical, side effects, dosages, efficacy, safety. These are very technical things which general population is now catching up with because they are locked in. But yet it's very confusing because they hear all kind of different things, and there is also so much misinformation in the system. But as you see, one thing that has happened in these stages is that risk perception has continued to decline. Uh, Whether that be through the deliberate campaign of the government, which was unlocking, or that be vaccine discovery. Moving on to the second component driving vaccine hesitancy, which is beliefs and mental models regarding the vaccination. And we see, of course, a difference between, again, India and other countries like the Western countries where adult vaccine is a norm. Uh, so here in US, you can get a vaccination. You're recommended to get a vaccination for flu every year. You can get vaccination for pneumonia. Preventive vaccination is taken for tetanus, uh, and so on. So, vaccination is a thing that most adults are aware of and have to make decisions for themselves as well. Uh, in the Western countries, in India, adult vaccines are available, but they're certainly not the norm. So when you speak to people about vaccination, the thing that comes to their mind mostly is child vaccination, infant vaccination, right? The routine that after birth you have to go through of different vaccination. And here people really don't try to, people have defaults about infant vaccination. Infants, children, childhood, that stage is seen as a fragile stage. Infants are seen as vulnerable who need medical attention, as opposed to adults. Adults, the mental model is adults need mental attention, medical attention when they have symptoms, when they have injury, right? But children, they children they default to you need to consult the doctor on small things, and you blindly follow basically doctor's advice because children are vulnerable and fragile. And so people don't uh, sort of try to understand vaccination too much from the child vaccination perspective. And in terms of their own vaccination, the only decisions that they've really had to make regarding vaccination is, which is not even vaccination, is either your rabies jab or your tetanus jab, which they equate with vaccination. uh, these both rabies and tetanus jab are post event, uh, not vaccines but jabs, right? So if your skin is punctured and then you get a tetanus shot, and if some feral animal, who rabid animal, bites you, then you get a rabies shot. So an event happens first, and before you start to get the symptoms, you get the shot to sort of try to fight the infection. So this is a post-event mental model, that you have to have symptoms first, then you take something. Or even if you don't have symptoms, you have to have a risk exposure event first, and then you take the vaccine. And so people come with that perception to COVID, and they ask, if I'm not exposed to COVID risk directly, then do I need to take the jab? That's another thing that's sort of contributing to vaccine hesitancy. Um, what we also see is that, again, people are defaulting to doctors just like they would in terms of child vaccine, which is a good thing. But as we'll see, there could be some problems with that as well. I'll come to that subsequently. Thirdly, the final factor here in sort of driving vaccine hesitancy are the risk and reward trade-offs that people have to make. And here people have two options, right? One is not taking the vaccine, and continuing other risk mitigation strategies like distancing, like mask wearing. The other option is taking the vaccine, uh, and then sort of managing what the situation is then. Right now, the communication about vaccine is that even after vaccination, you could spread the virus, so you need to wear mask. So firstly, they don't see a big difference in how their life would change in terms of dealing with COVID risk if they have to wear a mask without the vaccine and if they have to wear a mask with the vaccine, right? So that is one issue. The other, of course, is that when they look at the option of not taking the vaccine and continuing the status quo, you have the status quo bias, that is not doing anything, right? That's a cognitive bias. People have inertia, so whatever behaviors they are doing, they would rather continue doing that than sort of go off course, especially if there is any possibility of some negative outcomes. So we have the status quo bias coming in. Secondly, that people are very adaptive, and the lockdowns and distancing and wearing mask was a major disruption to people's lives in the beginning, like last year. But people have adapted to this new normal now. People have been doing this for a year, and so people have a level of confidence in what they are doing to protect themselves from COVID. It's familiar, it's habitualized, to wear mask when you go out, or to stay at home. So people have become cozy and comfortable in this new normal. Earlier in the year, in 2020, people would compare their situation with pre-COVID times. That unfortunately has changed. Now the people have been in this situation for a year. People don't look at pre-COVID times. People now are looking at what their life is right now, and they see vaccine as something that will change that. So now they have to decide whether it will change it for good or for bad for them, right? So then they look at what are the costs and benefits of the vaccine. Firstly, the benefits are not seen. You don't have symptoms. It's not a rabies or tetanus vaccine. You don't have to have symptoms to get a jab. It's a preventive thing. So the best case scenario is you take a vaccine and you never have to find out why you took the vaccine. Because when you will have an exposure event, it will not affect you. So you'll not find out that you actually were at risk and were actually exposed because the vaccine protects you. So the benefits are, of course, not seen. The benefits are in the future. Uh, and secondly, as we have seen, the risk of COVID itself, the perceived risk of COVID itself has gone down for many people. People have been desensitized to COVID risk. People now believe what the kind of stuff that we hear is now it's like seasonal flu. It comes and goes, and it can be managed for large part of the population. So benefits are sort of underweighted. Uh, and the costs of taking a vaccine are overweighted. Firstly, because it's unfamiliar and new, right? So wearing mask and distancing is now familiar, habitualized. I can do it. Everyone around me is doing it. But vaccine is new. What to make of it, people don't really know. People, the trust in media sources, in experts and politicians has declined globally during the pandemic, because there was often a large discrepancy in what people saw around them and what was being reported in media during COVID. This was simply because, there were always clusters of more cases in places, but precautions had to be taken everywhere. But people didn't necessarily see the need for precautions. But governments still had to practice precaution. But that discrepancy created some distrust. A lot of information was evolving, a lot of understanding regarding uh, COVID was always evolving. So first, there was people did a lot of experts didn't believe that masks were going to be effective, and then there was work done to actually show the efficacy of masks, and then it was mandated. So there were, again, even from experts, there were different information coming, and that led to sort of a fall in trust. So this combined with the unfamiliarity sort of uh, increase the salience of whether this vaccine, do we fully understand it, do I fully understand it, do the experts even fully understand it. Secondly, the side effects or the negative information about whether it be during the trials or now that the vaccine is being rolled out, negative information or adverse events or cases of side effects tend to be over-reported in media compared to positive events, right? So there's a media bias. Media would rather report a death that happened following immunization, whether it was related to immunization or not medically. But that's a news. While, just like the same number of people being vaccinated today as yesterday is not a news. And so negative information is being repeated more, reported more in media ecosystem, which is also, again, adding to the perception that there are a lot of negative consequences of the vaccine. And finally, the entire process being fast tracked, of course, can be seen in a negative light as well, that it's rushed. Uh, and then it's a question of, do you understand whether all the protocols for a normal vaccine were still followed in this case or not? And they were, in most cases, they were, even though they were rushed, all the protocols were followed and all the data is available. But in some cases, they weren't. For example, the Bharat Biotech vaccine, Covaxin, in India, there has been a little bit of a controversy about it being given a green signal for emergency use without completing phase 3 trials. It's now been completed and there is good information coming about it. And government has to make these kind of prudent decisions sometimes, but it cannot be denied that this kind of rushing of process will lead to some hesitancy, and it has. And this is the part that affects even the medical practitioners. So we spoke to some doctors about COVID vaccine hesitancy as well, and though they are mostly on board with COVID vaccine, they want to get the vaccine themselves. When it comes to the issue of a rushed trial, like in the case of Covaxin, even doctors are hesitant, and even they would tell their patients, that okay, this one we have to be cautious about. And again, we saw that people are more receptive to doctors, and when you can't get the medical community to be recommending and supporting a particular vaccine, then that can land you in trouble. So this basically is the picture as we see. Firstly, there is a lot of information that people are always reacting to. Not all the information is correct, and it's always changing. So people have to run very fast to keep up with what's happening around COVID. Secondly, vaccine, people don't really understand. People still see that as a post-event thing, as a curative thing, that you are either exposed or you see some symptoms and then you take the vaccine. Uh, and then finally, when you compare taking the vaccine to not taking the vaccine, not taking the vaccine, you're used to by now. You're used to all the things you have to do in your normal life to protect yourself from COVID. And most people have confidence because a lot of people, majority of people, have survived the pandemic till now. So they feel that they are doing something right. So they are confident in what they are doing right now, and they're not sure if vaccine is necessarily a good thing because of the negative information out there, because of the rushed trials, and because it's just a new thing and people would rather wait and watch. And that's what we are seeing mostly, this wait and watch strategy. And sort of the final slide, I know a little overwhelming information here. I'm going to quickly summarize what we are saying here. The idea basically is of a spectrum of hesitancy, which goes all the way from confidence in the vaccine uh, to skepticism and sort of having being anti-vaccine almost. But it's a continuum. You see, it's not that people are either confident or skeptical. You see people all throughout. So jumping to the first group here, we see uh, a segment of population which is very much pro-vaccine, which is very much pro-COVID vaccine as well. They believe in COVID vaccine. They believe that they are at risk of COVID and hence COVID vaccine is relevant to them. But they are overwhelmed with the amount of information out there and they don't know if they have the right amount of information or the right sources of information to make a decision. So these people are hesitant only to make the decision. They are not hesitant about vaccination, about COVID vaccine, but they are hesitant about, do am I making the right decision? But they are receptive to information from experts, from doctors. And so what we need to do here is build confidence that they are making the right decision. We can do that firstly by removing the decision there. So in a lot of cases, government is prescribing that you take the vaccine. For example, frontline workers, for example, people with comorbidities. You're almost creating a default that people can still opt out of. But the default is that we will vaccinate you. And that default works because people are scared to make the decision. They don't know if they have the right information to make the decision. But if someone else is making the decision as default, they'd be happy to uh, go ahead with it because they are pro COVID vaccine, because they do feel there is a risk. Then we need to, of course, reassure them with experts and doctors and create an expectancy of side effect. Tell them, make sure that the right kind of information is going to them because these people are receptive to information, they do trust it. And you don't want to break that trust. So you want to be very transparent with these people. So you want to talk about the safety of the vaccine, how it's safe, and how there might be some expectations of side effects and such. Next, you have a population segment which is complacent about the vaccine. They might still have positive views about the vaccine. They might still perceive that they are at risk. But what they feel is that what they're doing already is sufficient to protect them from risk. And so they don't need vaccine unless they are putting themselves at extraordinary risk. So say if they have to travel, they think that that's a context where they need to, think of vaccine. But if they are sheltering at home, if they're distancing, if they are wearing mask every time they go out, it's been working for them for a year. It will continue to work for them. So do they really need to expose themselves to side effects? An alien thing entering their body for no reason. I mean, they do trust the vaccine, but they think it's unnecessary because they're already doing things which are protecting them from um, COVID. And what we need to do here is these people are taking COVID seriously. They are so seriously that they think they're already protected. We need to use that self-image that these are smart people, that these are cautious people, and tell them that they do need to vaccinate as well as these cautious and smart people who have been complying with everything and who have managed COVID very well till now. The next step for them in managing COVID well is getting vaccinated. So talk to them about, getting exercising control. They feel that they are in control. Tell them that this is also sort of contributing to that control, right? And the decision is in their hand and they can make a smart decision. We can also increase the cost of not getting vaccinated. So these people may be compliant because of things like regulations. Uh, And so if we have regulations around vaccines, so if you can't travel internationally without a vaccine, or if you can't go to workplaces without vaccine, that might again create a better case for taking the vaccine for these people. uh, the next segment is the indifferent segment, which thinks that vaccine is just not for them. They don't doubt the vaccine, but they think they are not at risk. Not that they are not that they are managing risk well, which is the previous segment, which thinks they are at risk, but they're doing everything they can. This one, which tends to be young population or tends to be population away from urban centers, which have not seen a big spike, who think that vaccine is irrelevant because they are not at risk, and so they think it's just something that they'll put in their body which they have no need of. Here what we need to do is change focus from themselves, who may not be at risk, to people around them who may be at risk: elder people, people with comorbidities, and the larger society, which is shut down, can be restarted if everyone gets vaccinated. So here we need to, the young people especially, we need to sort of make them think not about their own risk, but the risk to society, to risk to people around them, their loved ones, their families, friends. And if we move that locus, then people might see the advantages of vaccine at a systemic level, even if they themselves at an individual level are fine. We also need to remind people that don't get used to the new normal. Let's at least aspire to reach some sort of pre-COVID situation. We don't have to live, even if you are personally not at risk, your freedoms have been taken away, your mobility has been taken away, your agency has been taken away because of lockdowns, because of everything that's happening to fight the COVID pandemic. And so even though personally you might not be at risk, you will still gain if the society is able to put the pandemic behind it. Again, and increasing the cost of not taking vaccine would also work here. Travel restrictions, restrictions on mobility, and so on. And make it easy, right? So this population does not feel that it really needs to do it. So you really need to make it easy for them to do it, convenient for them to do it as well. And lastly, the segment we are seeing as the most hesitant, we are calling them skeptical. They see vaccine as not just unnecessary, but also unsafe and ineffective. Now, these are the people who start buying some of the misinformation. These are the people who be may have doubts about COVID vaccine itself because of the rushed process. In India, we don't see people who just have problems with vaccine itself, but COVID vaccine particularly is different from other vaccines, and sort of their thought is that this is rushed, and that there are vested interests of governments, of pharmaceutical companies, medical community, and so on. And so the main thing about this group is a lack of trust, and because of that lack of trust, they don't buy what is being said about the efficacy and safety as well. And uh, so what we need to do here is basically reduce the mistrust first. We need to here be sort of go overboard in terms of getting the leadership, experts, to talk about the safety of the vaccine, to talk about why the vaccine is necessary, to keep to make the entire process transparent, the costs around it, how are side effects sort of dealt with, and all those things, to win back that trust, to use the sources that they do trust. They may not trust the leaders, political leaders, they may not trust experts, but we need to find who are the people that they do trust. Some of them do trust their doctors, some of them do trust their community leaders or their religious leaders or their family members. So we need to get to these people through them. So if we create a good amount of critical mass of vaccinated people around them, then they could influence these people, even though they are not listening to experts. They would listen to people around them. Uh, so making sort of vaccination drive more visible, like you have the ink mark following voting, you can have a mark of being vaccinated, which can show these people that even people around them are getting vaccinated. It's not something that they need to mistrust or be especially hesitant about. So yeah, I think basically to conclude, I know we are almost out of time as well. um, to conclude, what is required is a very, very sort of nuanced approach, customized approach, to really understand the different uh, segments within the population. Each of these categories, you could now go back and correlate to some demographic data, some behavioral data, which is already available. And so you can identify these through those kind of data, and then customize how you are approaching these populations to reassure them in the unique way in which their sort of hesitancy is manifesting. And if we are able to do that, we can reach herd immunity much faster. We are seeing that all over the world, in India, in Western world, in other countries where vaccine is being rolled out, there are delays, and they're not just logistical. People are not showing up, and that would continue to be a problem if we don't fully understand this problem. And so what we want to do is this, again, going back to our research, this is just the first phase. We are starting to understand the dynamics of this, the nuance of this problem. What we plan to do and hope to do in subsequent stages is also to sort of scale this up to national level, so we can sort of put numbers and statistics around these different segments, and hopefully that can then sort of inform um, policy and society's response to the pandemic. So I'll stop there now and yeah, open it up to questions. And again, Nikhil and NDBN team, feel free to pitch in as well, how you'd like to sort of manage the discussion.
Thank you, Saransh, for such an insightful talk, especially on the spectrum of hesitancy. That was very insightful and was something new. So we are opening up the session for questions among the audience. So if you do have your question, please do write in the chat box, and then we'll take it from there. Sanj, I just had one question. I had one question which I want to ask you. You spoke about reducing the mistrust among people to get them to be more vaccinated, and especially in the last group with the highest hesitancy. But given India and how our elections have panned out and the majority support for a single party, how much do you believe, or to what extent do you believe, vaccine hesitancy will decrease, considering now our political leaders have been administered with the vaccine, and that too with Bharat Biotech's vaccine?
Yeah, yeah. No, that is a very, very good step. That Bharat Biotech vaccine was taken visibly by the political leadership of the country. That is a very good step towards bridging that trust gap. That will go a long way. We have just seen that that's a recent event. That will take time to get all the way to the ground. The problem is it is a very dynamic context, and a lot of hesitancy has already been driven by how it has been managed till now. So there is still irreversible damage that has been done by rushing the trial, by even in, I mean, medical community, right? So those are the stakeholders that you would want on your side, and to be, fighting vaccine hesitancy on the front line, directly with vaccine hesitant patients. And so there has been some damage that has been done, but steps like this, like publicized vaccination of political leaders, other popular celebrities, will go a long way in bridging that trust gap.
Okay, thank you. Sukanya, if you would like to come in.
Thank you. Again, thank you, Saransh. I understand it's like 6:30 in the morning, so that's quite a great conversation that we've had early in the morning. Before I go on to the questions that we have from the network, we have some questions on the chat box that I will read out. So Sanika has asked, does the generalization of interventions become difficult on a large scale when there are such spectrums within the demographic?
Mhm. So, yeah, I think what becomes difficult on a large scale are one size fits all approaches, which unfortunately we see in large parts of policy still. Uh, and what we are seeing, at least till now, in terms of vaccine hesitancy. Uh, the campaign is sort of a sort of nationwide campaign. This sort of very targeted, segmented, customized approach hasn't yet started, not only in India but really anywhere in the world. Uh, and that is a problem. We do have solutions for it. It's not like that there is no way to deal with a spectrum. What you need to do for a spectrum is very different from what you do when it's the same thing. For example, uh, lockdowns was a one size fit all approach, and it had to be a one size fit all approach, and it was done that way, and it works. But as we see, hesitancy is not. So you can't deal with it the way you dealt with lockdown, with sort of just one national campaign, one line of communication. No, you need multiple line of communications. You need multiple framings. You need multiple sources and multiple ways of approaching this, because everyone's hesitancy might be slightly different. And so this can be customized to the level of each patient, because at some level every individual is interacting with the system. At It might be at the point of vaccination, it might be before the point of vaccination when they are talking to their doctors about it, it might be through, say, Cobin app or Arogya Setu app, but people are interacting directly at individual level. And so it can be customized even to individual level, but definitely to different segments of population. Maybe you need a different strategy for rural versus urban population, low income versus high income, low literacy versus high literacy. Maybe you need a different one for older people versus younger people, people who are in essential services versus people who are in non-essential services. So that sort of customization is important. Not that it cannot be done, but it is not being done. But it can be. It is definitely available to us.
So I have two questions, one which I will combine with others also. Uh, Given that you said that there are these spectrums and that socioeconomic classes can basically be targeted differently, in your work at Final Mile, have you guys looked at these slices and seen if there's a correlation between these classes and hesitancies?
So yeah, that's a work that's planned in the future. That's sort of the subsequent stage, actually the very next stage of our work, where we will take this framework, where we take this understanding of what the drivers of hesitancy, and do a more representative, quantitative exercise.
Right.
This is qualitative, right? Here we are trying to do deep understanding rather than sort of wide understanding. We are not trying to get big data.
Yeah.
But for when you have to scale it up, then you do need that sort of big data, and that's a subsequent sort of stage. Uh, and yeah, we do plan to do that. We can then, with that sort of an approach, be able to link these to demographic data, be able to link this to other kind of behavioral data which can be captured through these apps, Covin app or something, through simple surveys, through or at the point of vaccination. Like a frontline worker can have a simple tool to ask 3-4 questions to the person, and based on that, assign this person in a particular category, and based on that category, customize your communication to this person. uh, uh, what kind of artifacts do you give to this person, how much attention do you give to this person, and all that can be done. So those are subsequent stages that we do plan to do. Not yet, we have not done that yet, but we are trying to get sort of partners and stakeholders on board who are interested in sort of scaling this up to national level,
Right.
in India and I think globally.
So my follow-up would be, please do come back and share your results then. But before that, questions on this one is that now we've spoken about multiple channels of communication, right? Which also increases multiple channels through which misinformation can be spread, right? When you're talking about having trusted um, leaders or trusted religious gurus talk about these things, we already have that. People have insane amount of trust in people, which is also the problem, right? Because misinformation through religious channels is massive right now, and WhatsApp's already doing a lot of that. What do you think about that, and how do we, you know, prevent that?
Yeah. Yeah, so that I mean, the misinformation ecosystem is a big problem. In not knowing who to put your trust in times like this is a big problem. Uh, what we do see is um, the dynamics of how people place their trust is quite unique in this case. We do see people thinking of the political aspect of COVID, the commercial aspect of COVID, the health aspect of COVID, the social aspect of COVID very differently. We have sort of spoken to people who would otherwise take their doctor's advice blindly, and they have taken vaccinations in past and all. Not just in India, across the world we have seen this. But in terms of COVID, they think uh, that the doctor is being naive if they don't see the political ulterior motives or the commercial ulterior motives. That the doctors might know their thing, but they don't know something else, which they have learned from this, ecosystem of misinformation. And so we see that yeah, when you have doubts about the commercial aspects of it, then you even wonder whether the doctor is on your side, or whether the doctor is being again is doing this because there's either government pressure, or the companies manufacturing these vaccines are pumping a lot of money into the system. So all those things sort of start to come in once you doubt the information around you. And there is a lot of reason for people to doubt information around them. In the last year, there has been a lot of misinformation. A lot of experts have faltered. Now that's the part of doing science. You learn and you correct yourself. But what people see is that even the experts don't know what they're doing. And so people are able to sort of see that they have to even take the doctor's advice with a pinch of salt, that they can't even trust the political leadership that they would trust with other issues. Can they trust it when it comes to their health, uh, their family's health, their vulnerable loved ones' health? So we do see uh, you know very different patterns. You wouldn't expect this in usual circumstances, but COVID is a very unique circumstance, and we do see some aberrant behavior.
So, given the fact that we have a paucity of time, is it okay if we come back to a lot of these questions with you to you later, and we can just circulate like a follow-up paper to everyone else with the questions and the answers that Saransh gives us? But before I close, I'll just ask one more question, which is Akanksha's. Uh, how do the behavioral insights that we're seeing that you've spoken about primarily feed into government's plan or approach to mass immunization?
Yeah. So what we try to do, of course, this is a self-initiated effort. What we have been trying to do is engage with stakeholders. Uh, uh, and there are multiple stakeholders involved in this. There are organizations that are deploying the vaccination on the ground, that support the government. There is, of course, government policy makers and different levels of government. There are state, national governments, administrations at district and field level. There are global organizations, WHO, other sort of donors who are working on vaccination and scaling it up. Uh, so we are working with all these stakeholders, and we are just making our insights publicly available, and making a special effort, especially to disseminate among these circles, uh, to sort of translate that into action. And that of course is something that is our effort. We will continue to do that because we want to see this to inform policy. We want, we do see a big discrepancy on how much attention has gone into the logistics of it, the regulatory aspects of it, and how little attention is going towards communication, towards building the right kind of attitudes, feelings, and perceptions among people. That is a big gap. And things like that can uh, bridge that gap. But yeah, we need to make the relevance of this work being seen in the right circles, because right now it is not being seen. That is a problem, but we hope to do that. Yeah.
Great, thank you. I will pass it on to Nikhil to close. Thanks from the network to you, Saransh. Thank you.
Thank you, Sukanya, and thank you, Saransh, again. With that, we would just like to close our first event of the year. Thank you to everyone who has joined. We will get in touch with you all with a brief of the entire session. Again, thank you, Saransh, for taking time out and addressing us.
Yeah, pleasure. Thank you very much for organizing this, and yeah, have a good weekend.
You too. Bye.
All right. Bye. Thanks.